As we gather here today, it is important to acknowledge two vital aspects of women in the field of medicine. One, the women who are part of the healthcare system, dedicating their skills, time, and passion to healing and caring for others. Two, the women who depend on the healthcare system for their well-being and that of their loved ones. The first aspect is often what immediately comes to mind when discussing this topic. The second, perhaps sometimes not emphasized enough, is just as important. It is vital that we include and empower the women who rely on the healthcare system, often bearing the weight of illness, caregiving responsibilities, and navigating complex medical journeys. Their voices and experiences are equally important in shaping the inclusivity and effectiveness of our healthcare systems. The theme Inspire Inclusion must include both ideas. Some women, due to poverty, limited access, or suffering the consequences of societal challenges, have unfortunately fallen out of the system and thus have nowhere to turn. We need to extend our reach to them, ensuring their access to healthcare, providing essential information and education, and empowering them to make informed decisions regarding their health and that of their loved ones. Our efforts must encompass the availability of early screening and detection for preventable diseases, particularly for women in remote regions across the country. Additionally, we must extend our reach to include those who require attention, sometimes due to decisions that have led them down difficult paths. Teenage pregnancies, for instance, is a prime example, and I'm pleased to see this issue being addressed within this forum. No one should be condemned or defined by a single mistake in their life. Another example of inspiring inclusion is our national HPV vaccination program, which has been a great success. Malaysia introduced free HPV immunization in 2010 in the Malaysian Schools Health Program. In fact, Malaysia, together with Australia and Bhutan, won an award for the very successful rollout of the program. But even with that success, which is no mean feat considering our country's proudly conservative values, there are still many, many girls left behind. One worrying impact of the COVID-19 pandemic is that an estimated 330,000 eligible school-going girls have either missed their HPV vaccination or have incomplete doses due to school closures and disruption of the world supply of vaccines. To address this, the National Cancer Society of Malaysia has embarked on a nationwide campaign called Leaving No One Behind. Working with local groups and with support from the Health Ministry and donors from the private sector, outreach programs are being organized to make sure every girl gets a chance to be vaccinated and protected from this preventable disease. I had the privilege of launching the national level program in February last month, and I am left humbled by the passion and dedication of all those involved in that campaign. The success and importance of women within the healthcare system cannot be overstated. As we gather here today, we are not blind to the pressing challenges facing our healthcare system. The Ministry of Health, in its strategic framework of the Medical Program 2021 to 2025, has identified unmet human resource needs with increasing workload and capacity as one of the primary challenges to be addressed. Hospitals are understaffed, underfunded, overcrowded, impacting the quality of health care provided for patients. It's not surprising that a 2018 survey of 2,600 mothers across Malaysia, Singapore, and the Philippines found that 75% quit their jobs due to lack of flexibility on issues such as lactation room and unavailability of child daycare. This and similar statistics highlight the urgent need for us to address the challenges faced by women in medicine. Through their role as a mother and most often primary caregiver for their children, is a constant balance between the needs of their career and needs of the family, especially so during pregnancy and after birth. This is the reality of women not only in the medical profession but in all careers. We have to take up the challenge to address the myriad of issues and challenges that we face, from access to quality care to disparities in healthcare delivery. These are challenges that require collaborative solutions, whether it be balancing work and personal life or navigating the complexities of the system. These challenges are part of the journey. The MGPerak has put together a program which features a diverse cohort of speakers from various branches of medicine. Let us approach today's discussions with an open mind and heart. We may not be able to resolve all the issues we discussed today, but it is crucial that we have honest conversations. By sharing our experiences, insights, and challenges, we create a space for learning and growth. I leave you with one ask today. Let us commit to being agents of change in our own sphere of influence, our own home, our own communities. On this International Women's Day, let us reaffirm our commitment to inspiring inclusion in not only the field of medicine, but in all aspects of our lives. Together, we can create a future where all individuals have equal opportunity.